Okay, good morning, everyone. I think we'll get started. So welcome. We're so glad you could join us today for this incredible symposium. My name is Laura Folan-Ross, and I serve as the Associate Director of the Precision Mental Health Research Programs here at the Center for Precision Mental Health. It's my pleasure to welcome you all and guide today's program. Before we begin today's wonderful talks, I want to take care of some brief housekeeping items. So first, for those of you who are seeking CME credit, the course evaluation and claim instructions will be emailed to you within a week. And this activity is jointly accredited by the Stanford School of Medicine to provide continuing education for physicians, nurses, physician associates, and psychologists. Today's sessions are being recorded. These recordings will be available after the symposium on our YouTube channel shown here, so you can revisit the talks or catch anything you might have missed later. We encourage you to join the conversation online. Please find us on social media and also tag us using our symposium hashtag for today, which is PMH_2025. Make sure to spread the word about all of the exciting talks happening here today. If you're interested in becoming a research member of the center, you can scan the QR code here or visit our website, or you can speak to any of the center staff. We have yellow ribbons affixed to our badges. And we also have a corporate affiliates program for our industry partners. You can learn more about scanning this code or visiting our website. And lastly, we will have 2 standing mics for today's Q&A after each talk. They're located here and here. So if you have questions for the speakers, just make sure you find one of those mics. Okay, so now that housekeeping is out of the way, it's my pleasure to introduce the visionary behind today's symposium, Dr. Leanne Williams. Dr. Williams is the founding director of the Stanford Center for Precision Mental Health and is the Vincent V.C.Woo Professor of Psychiatry and Behavioral Sciences. She is internationally recognized as a pioneer in precision psychiatry, whose research has redefined how we understand depression and other mental health conditions, moving beyond symptoms to brain-based biotypes that can guide treatment decisions. She has built the center into a vibrant community that brings together clinicians, scientists, and partners to transform mental health care. And she launched this symposium 5 years ago to foster dialogue and discovery at the frontiers of this field. Please join me in warmly welcoming Dr. Leanne Williams.
Thank you so much, Laura, for that really warm welcome. And good morning, everyone. It's a true pleasure to welcome you to our 5th annual symposium of the Center for Precision Mental Health. This year is a landmark. Since our founding in 2018, this is the 5th time we've gathered. And today's theme, Bridging Psychiatry, Neuroscience, and AI, reflects the incredible momentum in our field and across the campus. The momentum is clear. We have close to 1,000 registrants joining us today. As many of you know, mental illness touches nearly all of us. 1 in 5 will experience it in any given year. Half of all conditions begin by age 14 and 3/4 by 24. Yet too many people still go untreated or face years of trial and error, and the consequences are severe. Life expectancy is shortened by 10 to 20 years. Suicide is now the leading cause of death among US people, young people, aged 10 to 24. This is deeply personal for me as well. My partner, an ER physician, died by suicide after struggling with depression. Despite his medical knowledge, he felt the stigma was too great to seek care and have a depression diagnosis on his record. Mental illness profoundly disrupts daily life, work, school, relationships. And it's now the #1 cause of disability worldwide, greater than heart disease, diabetes, and cancer combined. Yet today we want it to be a message of hope. Our center was founded to meet this urgent need with ambitious goals, and I'm proud to share how we're delivering on them. You'll hear today about how we're advancing transformative technologies, new precision treatments, and AI tools to integrate data at scale. These successes give us genuine hope for the future, while reminding us of the urgency to deliver new solutions. For us, precision means the whole system, shaping a person's mental health, their biology, and the context in which they live. Increasingly large data sets allow us to uncover individual brain signatures while also seeing the population patterns that drive outcomes. And AI is central. As you'll hear today, it's helping us translate discoveries into real-world clinical impact. And now we're taking the next step. One of our biggest goals has been to create a dedicated home for our center, and I'm thrilled that we'll be sharing a very special announcement about this new home. Stay tuned for that announcement. Before we begin the program, I want to acknowledge the extraordinary community that has made this all possible. All of you here today, and also the 93 faculty and early career members that form our center. They span 7 schools, 24 departments across Stanford and VA. And the leadership team in our center strengthens this network. My incredible co-director, Ruth O'Hara, and associate director, Alan Schatzberg. And our key directors leading our flagship initiatives, Hosna Omazad, who has led this event today, Dr. Lara Follen-Roth, who you just heard from, and who has overseen the scientific program, Dr. Shui Chung, who led the poster program, Dr. Lara Hack, who oversees our clinical translational program, Drs. Nir Eshel and Teddy Akiki are key leaders in our corporate affiliates program, and industry leaders who are here today. We invite you to connect with them. My deepest thanks to them all. Our work is profoundly collaborative, and today we welcome distinguished speakers from psychiatry, from neurology, radiology, computer science, engineering, biomedical data science, and beyond, representing the full power of Stanford's cross-disciplinary research. We are joined by partners from UCSF and from the University of Illinois, Chicago, and other leading institutions. This symposium also includes the voice of advocates, families, and individuals who have lived with mental illness. Your courage and your leadership reminds us why our work matters. Our next generation of innovators will showcase their work in our poster session. I'm inspired to see so many early career researchers presenting their contributions, and those are essential to our shared mission. Of course, none of this would be possible without our dedicated supporters, whose vision and generosity truly makes it all possible. Your belief in our mission fuels every step forward. Thank you for making these innovations and this symposium possible. We invite your partnership. Please connect with our development officers who are here today. I also share my heartfelt thanks to many colleagues in communications, grants management, HR, finance, and administration. You provide the foundation that makes every discovery, every trial, and every event like this possible. Together, we're building a future where precision psychiatry is personal, practical, and transformative. I'm truly excited about the conversations and collaborations that will be sparked today. Welcome to the 5th Annual Symposium of the Stanford Center for Precision Mental Health. To officially open our symposium, it's my distinct honor and pleasure to introduce Dr. Lloyd Minor, the Carl and Elizabeth Neumann Dean of the School of Medicine and Vice President for Medical Affairs at Stanford University. Dean Minor has provided extraordinary leadership in shaping a bold, visionary approach to the future of AI in the life sciences at Stanford and beyond, with precision health powered by AI. Please join me in welcoming Dr. Lloyd Minor to this symposium.
Well, thank you very much, Dr. Williams. And it's so wonderful to see the room filled with people who have a shared vision and passion for the development of the field of precision mental health. And I want to begin by thanking Dr. Williams, Dr. O'Hara, for their leadership of this wonderful initiative. This is the 5th annual symposium, of course, and from the very first conversations we had a number of years ago, it was clear that this initiative was going to have enormous impact because of the quality of the people here at Stanford who were being brought together, and also because of its reach far beyond the Stanford community to industries in our area, as well as to other academic centers around the country. Now, the need is enormous, of course. For all too many years, mental illness and mental health in general has been considered separately from other aspects of our physiology, from other aspects of our health. And a lot of the precision that we've seen in other areas of medicine, in areas such as cardiology and oncology, a lot of that precision has not necessarily translated directly over into understanding mental health and how that relates to brain function. And thanks to Dr. Williams and her team and so many others in this room, we're now seeing the same degree of rigor, the same degree of data-driven science for approaching complex diseases such as depression that we've seen for many years in other aspects of medicine. And of course, these approaches involve using the latest imaging technology, brain imaging, which Dr. Williams and her team have been a pioneer in using. And as Dr. Williams mentioned, in garnering information from all the data we gather from these imaging studies and other studies, garnering information by using AI and deploying AI, in particular, the revolution we've seen in generative AI. And already we're seeing the effects and the benefits of taking this approach. Dr. Williams and her team have defined archetypes of depression. We know, sort of before this work, we had known anecdotally that depression manifests itself differently in different people. And also we had some hint that not every patient with depression is going to respond to the same approach to the treatment of depression, that there are categories of antidepressants that may work better in some patients, but not work at all in others, that some patients with depression are amenable to and benefit from cognitive behavioral therapy, whereas others do not. But then how do we assimilate the information that we have from, say, the phenotypic manifestations of depression with the biology of depression that Dr. Williams and her team and so many others are studying based upon imaging studies and a variety of other biomarkers of depression? And I think we all have the sense that this work is progressing well, but it's still in the very early stages, and that the best is yet to come, and the best impact is yet to come. So I wish you all the best for your conference today. I thank you so much for being here, Leanne. Thank you so much for your leadership of this important center and activity. And I look forward to tracking the progress, and along with my colleague, David Entwistle, the President CEO of Stanford Healthcare, we look forward to supporting these initiatives and making sure that that the benefit of this work gets out to our patients who depend so much on the care we provide. Thank you.
Thank you so much, Dean Miner, for your inspiring words and your unwavering support for our center. It's my pleasure to now introduce David Entwistle, President and CEO of Stanford Healthcare. David Entwistle has been at the forefront of bringing AI into patient-centered care. His vision aligns perfectly with today's theme of bridging psychiatry, neuroscience, and AI. Under his leadership, Stanford Healthcare has been recognized as one of the top academic medical centers in the nation. And in his own words, at Stanford Medicine, it is our mission to validate that trust through the highest standards of clinical excellence. Please join me in welcoming David Entwistle.
Well, it is wonderful to see you all today, and what a robust group. It is an amazing group of, again, intellectual horsepower just waiting to be tapped. I'm excited by that. I will join Dr. O'Hara, Dr. Williams, and Dr. Miner and welcome you here today. I'm particularly excited about this agenda topic, I have to tell you, as Leanne was just reading from some of the things that we're working on. But I wanted to share just a few comments with you. If we think about some of the cutting edge research that's actually occurring, some of the things that then will be applied to clinical care, and how do we make that better? We know that it is challenging in the area, especially with behavioral health services, to have enough resources right now. That is one of the areas that's probably the most underserved as we look at the services that we're looking at across the organization and be able to tap that. How do we bring together some of the collective inspiration, knowledge, awareness, clinical science data to some of the technology and how that gets applied? And so I'm particularly excited about, especially Leanne's research in this area and some of the work that's being done to how do we apply this to precision mental health and wellness? How do we take some of these tools and augment them? AI, sorry, you can't go anywhere now and not talk about it. Everything that's in our vernacular, everything that we're seeing. What does this enable? I mean, the reality is, and Lloyd mentioned this in his comments, we are now bringing together vast quantities of data that haven't been able to been tapped before. We now have the computational horsepower to be able to apply these large language models to this data. It was exciting coming in, just seeing one of the poster boards. It was talking about how do we use large language models to predict potentially depression? How do we take some of these tools to better enable? And I will say, AI is an enabler. It's there to augment. It's probably better to say augmented intelligence as opposed to artificial. So how do we take that and apply it in some of these perspectives? Literally, I have to say, AI has been around with us for a while, but since ChatGPT exploded onto the realm probably about 3 years ago, that's really what's kind of brought this into our vernacular to say, actually, there's probably something more than just the hype that was there before. And I think that ability to apply large language models in our own lives and be able to use those. I will say my son, who used this a lot, just graduating from college. So again, it was interesting. You now have these tools available. I said, did you read this book? He goes, yeah, I had it summarized on ChatGPT. It was a great summary. I'm like, that's not quite the intent, but these are good for these tools to be there. So as we think about some of this promise within and in fact, every time I give this talk, my number has to change. We now have over 40 applications for AI literally running in our clinical environment within Stanford Medicine right now. Think about those tools that are there to enable and augment what we're doing, whether that is literally, in some cases, writing a note for our physicians to be able to respond to the plethora of feedback that they get in their email, whether that's predicting a heart attack, whether that's the ability to see this application of technology to where disease is. And I think this is one of the areas that is particularly exciting when you start to get into the agentic AI. I had an interesting conversation with our colleagues at AWS this morning because they were telling me about a study about a German-based model where they could apply the data set within Germany because they have an aggregated data set, and basically looking at it, comparing with the Norwegian model, which also had, to validate now a tool that they're developing to actually be predictive in modeling in disease. That's where I look at this technology and say, how do we help enable and better process some of the data that we have to actually be proactive? And isn't that really the definition of what precision medicine is? And what I think it leads to is what is then going to be precision health. How do we be proactive in those perspectives? So there's so many exciting areas today that wouldn't be possible, wouldn't be available to be really aggregated and discussed and developed without all of you in the room. And I think that's one of the particularly powerful things that I appreciate to Dr. O'Hare and Dr. Williams for bringing this symposium together. How do we learn from each other? How do we take these ideas and really start to apply them to the things that we need to make our healthcare and the patient experience and the ability to get treatment all better? And so really excited to have you here with us today, excited about what will be learned, what will be developed and grow out of this, and have a great day. I know these can be challenging days, so pace yourself. So thank you all for being here.
Thank you so much, David, for your leadership and inspiring us with those fantastic examples of the vision for AI-enabled preeminent clinical care. Before we turn to the first panel,